Hey everyone, welcome back to my channel. Today video it's gonna be an update of my total hysterectomy and endometriosis excision surgery. It's been exactly 1 year since I had that, and I wanted to let you know my experience with bioidentical hormone therapy and what you should expect during this period and how is the recovery, because I had so many questions and I watched so many videos that I actually feel that we all so different, and it's nice to put out there my personal experience and my personal view. I'm gonna start with this, that the very first 2 to 3 months were really difficult. I had, if you watch my previous videos, I had actually blood clot in my lung a couple of days after the operation. I had lots of blood loss and clots as well during that period, and lots of problems health-wise, low immune system, iron deficiency, and so on and so on. Plus the symptoms which I got for menopause symptoms or perimenopause symptoms stayed after the operation, like literally a couple of days after. To be honest with you, I already been in the transition through the perimenopause because I had the perimenopause symptoms since I turned around the age of 38, and I'm 46 now. Sorry, 45 now. So it was a process that I knew I'm in perimenopause, and then I've been working through it, and I check my reserve, and kind of through the process I found out I have endometriosis after my struggle. But obviously I was determined, this time, that I'm gonna try to use hormonal therapy, only because I always been against it, I'll be honest, just because I never really needed it, to be honest, during my life up till now. And if you don't need it, so why should you use it? That just makes sense, isn't it? But then after my experience with controlling endometriosis without the hormonal therapy, it looks like it wasn't going better, and it was coming back straight like a couple of 2 to 3 months after each excision surgery. And obviously going through hysterectomy, total hysterectomy, I had actually one ovary left. I removed the cervix, the tubes, but I was already in late perimenopause, and then my doctor said that my ovary reserve is so low, so he is expecting me to get to full menopause in max 1 year after the operation. So the first 3 months were really difficult. So past forwards, I've been on and off on the hormonal therapy, which were the three, which is the ostrogel, which is estrogen, and then I was put on utrogestan, which is progesterone, micronized progesterone, and testosterone, which is Androfem. This is the product that it's available only currently through a private consultants, not through NHS yet because it's not approved, but it's produced in Australia and it's approved in Australia for women use as well. So let me show you them actually. Okay, so this is the Astrogel I'm using right now. This is the testosterone gel, and Nutri-Gestan, I don't know where I left it. It's somewhere out here. Obviously, I've been suffering from vaginal atrophy as well. That's prior the hysterectomy, just because obviously, as I said, I was in late perimenopause stage and I wasn't using anything. So yes, after the operation, I was like, yeah, I need to use it because I been struggling with lots of bacterial vaginosis infection, infections, some kind of different bacteria concerning my bladder as well. And I've been on treatment for months and months and months and months, and they keep coming back every 2 to 3 weeks. And then obviously that was affecting my endometriosis as well, because they were connected. And endometriosis grow faster and faster because my my system, it wasn't in peace, it wasn't working properly. So after the operation, after I was clear of obviously the blood clot issues and the healing process after the operation, I've been prescribed vaginal estrogen, which is the Vagifem, and it's this little capsules, which at the beginning most of the doctors will give it to you for 2 weeks loading dose, and then afterwards will be 2 to 3 times a week. Well, after my loading dose, I start using it, I think, 2 times a week. By my atrophy wasn't getting any better. I was getting all the time thrush for constantly, I would say 5 to 6 months, every 2 weeks. And obviously, because having this all the time, I've been using fluconazole and other tablets as well. I got actually allergic reaction to it, and I had lots of allergic reaction to my skin as well, and my lips every single time I use it. So it was kind of all the time backwards and forwards to the doctors. And I remember in some of these visits, I visit actually a nurse practitioner, not my GP or my consultant. And then she said she was a lady, I think around 55 years old, and she said that lots of women actually struggle till the rest of their lives with that, with different, obviously, symptoms, vaginal symptoms, only because they need the estrogen over there on the tissue, because they're losing it, because systemic estrogen cannot actually supply the tissue down there with the estrogen they need. So that's why they're getting these infections. But no one really tells you these things, isn't it? So I was like surprised. She said, well, you're gonna have this until the rest of your life, if you don't use estrogen, vaginal estrogen, until the rest of your life. And I was shocked. Imagine, I'm only 45 at that time, after my operation last year. And I was like, well, wait a minute, if I live to my 80s, that's a half of my life I have to use this. And no one tells you this, no one gives you this information. The doctors just flag you off and you're like that. But anyway, that was her personal experience, and her experience with people and women at that circumstances. Again, obviously, I went back to my consultant and my menopausal specialists, and they agree that I have to have constant 5 times a week use of Vagifem instead of 2 to 3 times a week on continuous basis, because obviously we all different, our body's different, so that's mean I need it for time being, and they cannot tell me how long I will need it for. I will probably feel it when I can have to reduce it, or if I have to keep going the same dose. But it's apparently really safe to use it, because I think the usage for the whole year, 1 year of the vaginal estrogen, it's equivalent of 1 tablet of vaginal estrogen, which you're gonna use per day, which is 0.25 milligrams, I think, equivalent, or 1 pump of estrogen. That's how small it is, or 2 pumps anyway, for the whole year. So it's really safe, it's local, and it doesn't go systemically in your body. And then obviously they gave me a prescription for it. Obviously it was through my private insurance. And then after the first prescription, which is 3 months, I have to go back to my GP for repeat prescription. And during that time, I was ups and downs with my usage of the hormonal therapy, only because, obviously, bear in mind, My ovary was just working, not working, just working, not working. But the whole idea of them giving me a continuously progesterone and estrogen and testosterone, because my testosterone was like 0.08, which is, I'm telling you, so low. I can't even explain the way I feel is low libido, no estrogen, not low libido, no feeling down, like numb, like literally no feeling whatsoever. Constant pressure when I go to pee, like I feel constantly I have to pee, but I don't need pee in a constant in a sense. Low libido, low mood, as well. What to say? I started losing my hair. I don't know. There's so many things were happening, and obviously, when you at that age, you feel like, well, how I'm gonna keep going for all these years to come if I don't have something to sort it out. Obviously, it's a trial when it comes to all the hormonal therapy, specifically the bioidentical hormonal therapy, because the body does need 1 to 3 months readjusting, and then you find out, oh, actually it's not good enough, I need to up the dose or I need to lower the dose, so another 3 months. So that's why it takes so long to figure out what works for you, because I was reading so many. I'm a member of so many groups on Facebook, and the women are being absolutely amazing. I've learned so much. If you're not member of one of these groups, go and find them. I actually gonna put them down on my video, because I found out so many sprays, so many creams, moisturizers for vaginal atrophy, for how to deal with certain things. And then these women are being amazing. Like my best friends ever. They're better than my doctors, I would say. So thank you so much for that. And then obviously during that period I'm trying to navigate my symptoms, my infections, my sex life, my injections for uh, my blood clots. It was really, really difficult to navigate everything. And in the meantime, obviously I'm not quite sure what was the reason, because I had endometriosis excision from my bowel as well. So I've been suffering from the first week of actually my operation till probably 7 months after the operation. So 7 months non-stop. I had constant diarrhea, and I've been backwards and forwards, not only to the gynecologist and to the menopause specialist, to my GP, but to my gastroenterologist as well, because they had to see what's happening with me, on top of the rest of the stuff. And then during that period, obviously, I had the MRI, I have CT scan for my bowel in my area. I had a breath test, which it shows I have SIBO. Again, for the third year in a row. And if you don't know what is SIBO, just go and check my videos, Google it. It's basically something like IBS but worse. So yeah, go and check it out. I don't want to explain in this video, but apparently it's really common after operations, and especially operations like that. And lots of women have this thing, but they don't know they have even hysterectomies. Please bear in mind this is a possibility if the symptoms don't go away. So fast forward 3 to 4 months after my operation, I'm constantly on my hormone therapy, and I'm in UK, and I've been treated in UK, but I'm originally from Bulgaria. So I decided I'm gonna have another scan or another view of a doctor, what they're gonna say. I went back to Bulgaria for summer break, and I went to see a specialist there, which is obviously the same type of specialist in Bulgaria, and surgeon as well. And he looked at all my hormonal therapies and stuff I'm using, and he said, "This is rubbish. Do not use them. You look okay." He looked to screen me quickly. He looked at me and said, "Oh, you look fine. You don't need these things." And I was like shocked. I said to him, but I don't feel well. So I had over 28 perimenopausal symptoms, like a lot. When we start from blurry vision, when you said the hair loss, shaky hands, I had spots and rashes everywhere on and off. I had bruises in my skin appear just suddenly like that. I had something on my eyes. I can't remember what was the name of it now. That you get because of the lack, like block things here, so you can use makeup. Um, what else was I mean, as I had so many things going on apart from these hot flashes, the usual ones. In one point, I had 28 times a day I'll have hot flashes. 28 times a day, any time of the day, on and off, on and off, on and off. And I had this rush of energy, like I'm sitting like that, doing something, working or cooking or doing something or walking, and suddenly I'll feel this energy burst and I start shaking, tremendous shaking inside my body. You cannot feel you cannot see it outside, but I can feel it. And I couldn't, like, everything is blank, and it will take me a couple of minutes to get okay with it, or sometimes half an hour, I don't know, and I have to sit down and I have to deep breathe and it just relax really. But unfortunately, when you're working full time, when you're a mom full time, when you do your stuff at home full time and you want to go out with your friends and your family, it does not work. You can't just tell them, wait a minute, I'll come back in a couple of hours, and you disappear. It doesn't work that way. So it's really difficult to control, and there's nothing you can do, unfortunately. Even me taking the hormones, they weren't working, and not because they weren't working particularly, it's just because my body wasn't ready for it. Needs time to heal inside, needs time to adjust, and everything needs time. It's not a magic fix, unfortunately. And I was looking for magic fix and was devastated that I cannot help myself, and no one could have helped me. So basically, you have to get your body work its magic. Some women in were sharing experience that in about 2 to 3 months after the operation they felt amazing and nothing happened, and bum. And I was looking for this experience, but unfortunately it did not happen to me. So um, after this doctor told me you shouldn't use this because especially when you had a blood clot and things like that, and you feel and you look okay, I was actually confused. I didn't know what to do. And then at that time, I went actually to see him as well because I had my 11th burst of thrush after the operation. So 4 months after the operation, and that's my 11th burst of thrush. And it was horrible, basically. And he looked at me, he said to me, you're gonna have this till the rest of your life. You can't get rid of it, unfortunately, it will come and go. And I said, what? Thank you so much, but I don't think this is right. And then obviously he wasn't right. Yes, in some situations maybe you will have because you don't produce estrogen anymore, and the tissue is really dry down there, and that's why you have these infections. Really, your body just does it, even from a simple tissue that going to toilet. But it doesn't mean there's nothing you can do. There's lots of as well moisturizers, hyaluronic acid tablets, lasers you can do down there. Um, there are lots of things you can try, and I'm not quite sure which one will be better for you. But if you start like me, trying one another until you find what works for you, because that's what I did. So this is my 5th month already. I decided I'm gonna stop all my hormonal therapy, and then I left with that. I was actually without it 4 months after my operation for a good 3 weeks, and all my symptoms came back with bandage, like literally overnight, like literally 2 to 3 days after I stopped them. And then I was saying to myself, oh, they're gonna go away, but they were interfering so much with my daily routine. And then at that time, I never had migraines in my life. Never ever had migraines in my life. But after I stopped all the hormonal therapy, I suddenly start having these migraines that's so painful. They stay 2 weeks of the month, like every single day. I will be wiped out. From the moment I wake up with this headache, with this migraine, till probably 3 o'clock in the afternoon, every single day. So I couldn't work properly. I wasn't myself really, apart from the rest of the symptoms. So this is one symptom. So I had another 15 at that time, all go together at the same time. And then in my actually mouth as well, you have lots of ulcers. That's another symptom of perimenopause, which no one tells you, and other bits. And then I decided, you know what, I'm not gonna listen to this doctor. I'm gonna go back to my menopause consultant, which I saw in UK, and that was Dr. Hamid Hamoda, Dr. Hamoda. He was the next chairman of the British Menopause Society, and I said this have to be the best person there. And I spoke with him. He decided that because obviously I had at that time PMS symptoms really badly, like literally 3 weeks of the month I'll have PMS symptoms. When I said PMS symptoms, they were so severe, so I felt constantly bloated, constantly pain and heat on the back. Apart from the menopausal symptoms, it's basically they were similar. Like I had my endometriosis symptoms, the same. And he said to me that I have to up the dose of my hormones, my estrogen, because obviously I still have the symptoms, and my blood work showed that I'm in full-blown menopausal, and my estrogen was so low when I stopped it. Like literally, my estrogen was 50 or 60, and when I had to have a healthy bone, I have to have 250 and over, and I had 60 or 70. So imagine. At that time, he said to me if I can do my DEXA scan, just for me to know, because I never had that, obviously, to check your bones and to find out what levels of your bone health is. So this is like a starter, um, basically, point, because we didn't know what's happening. I had so many issues going on, so you can't really treat all of them at the same time. I mean, you can try, but you don't know where the symptoms coming from. Is it from my bladder? Is it from endometriosis? Is it from my menopause thing? What is it? I have no idea. Of my SIBO. So I did my DEXA scan, and it showed off that I have osteopenia, which was shocking for me because I've been doing everything right, taking my supplements and everything for years and years, and doing exercise and weightlifting and healthily eating and everything, but still show osteopenia. So I guess my body was fighting this. And at that time, I realized I don't care what people say and how against their HRT in general. I'm against the chemical one, the non the one that is produced and it's not bioidentical. But I'm not against the other one, because if you start looking into basically properly into the research, you find out they don't really put more hormones. They make your body thinks you have the hormones and work like you used to work. And that's what we need, especially now when I at such a age I'm losing everything, and I hopefully have another another 20-30 years to live. And so many women go through this even earlier for different reasons, and they've been refused or they've been misled. As well, I had lots of my my relatives, some of my relatives, which are a little bit older than me, telling me that I shouldn't be on hormonal therapy. Everything is in my head. They went through without it. Even my mom, she got naturally, she entered naturally menopause stage, postmenopausal stage at age of 43, and she never ever had problems. She said she had some non-sleepness, hot flashes, and problems for 2 years, and that's it. but I guess we all different. So I was keep consistent with my hormone therapy, with my treatments, with my different probiotics for my candida or for my thrush and everything. I was checking what I need. And I will say, up to the mark of the 7 to 8 months after the operation, I start feeling a little bit better. So it took me 8 months to actually start feeling a little bit better. Not better completely, but I will say 40% better than I should have been, which was positive for me. And then after this 40%, it took me another 3 to 4 months to realize that I have to focus more on protein eating. Like we're talking a lot of protein, like 40 grams a day protein minimum. I don't drink and I don't smoke, so maybe that helped me. So if you're out there and you're in this transition, you had hysterectomy, you didn't have hysterectomy, and you wonder sometimes why you have these elevated perimenopausal symptoms, believe me, even a glass of wine can trigger them to get worse. And I know you think, oh, what the life is without it. You occasionally you can have it, but it depends how far severe your symptoms. Because I don't drink and I don't smoke in general, so I don't miss these things. So I'm okay with it. But if you are one of those people that enjoy doing these things, I would suggest, and they elevate your symptoms, I would suggest you limit yourself to once a week. So, or the days when you know you can actually handle the symptoms, because they're gonna come with vengeance and they're gonna stay for a few days. Uh, that's what that was happened to me. So not necessarily, but most likely. And so you have to focus on your protein intake. You have to focus on lots of vegetables as well, because the big thing is as well the lack of fiber. We all think we enough fiber, well, we don't really. You need at least 30 grams of fiber a day, and I barely 10 to 20. And that's could be a big problem, because if you don't go to toilet regularly every single day, then your excess of estrogen will circulate in your body, and it's not good. It has to come out, and then the new one produce. So I will say that now, a year after my total hysterectomy, I'm still fighting. I still have some symptoms, but it's positive, because I know I have to stick to my hormone therapy, and I know I have to just adjust it from time to time. I will probably never stop this, the vaginal estrogen, for time being, because I remember one week, I think it was 10 months after my operation, I stopped it or reduced it. For a couple of weeks, only because my GP refused to prescribe it. She said that apparently the NHS guidance said that she's not allowed to prescribe it more than 3 times a week. But when you look at closely with the NHS guidance, they said, actually not 3 times a week, it was 2 times a week. They said you can prescribe it up to 2 times a week, when each one of it is 25 milligrams, or that's 50 milligrams. Now, a couple of years ago, apparently, the company that's produced this vaginal estrogen changed the capsule from 25 to 10 milligrams. So that automatically means that I can use it for 50 milligrams. I can use it up to 5 times a week, which is the 10 each. And that's what I've been prescribed. But she refused, and she said, there's no way I can give you this, and you have to go private through the rest of your life to take it. I was so upset. So what I did in one of the groups, thank you again for this amazing women in in the Facebook groups. One of the women actually, she posted the same thing, that her GP refused, and then she reached out to the digital GP and with her private medical care, and they were really happy to prescribe it. They said that's not true, there's nothing to do with that. And they actually told her that NHS says that, but on the old way of the company that produced this medicine. So basically, she sent the link with the NHS guidance, and I actually forward this to my GP. And after she's seen this, along with a letter from my consultant menopausal specialist, she agreed to prescribe it. And being able to use actually my bioidentical hormones and vaginal estrogen helped me to gain uh, everything, really. My confidence, the estrogen start working, the vaginal estrogen start working. So I still may have sometimes some bacterial zoonosis or thrush or any other infections, but I haven't had any since actually no, October last year. So we're talking about 6 months, and I'm really, really happy about it. I'm 100% sure that definitely what I eat, my lifestyle, the exercises, and the estrogen helps me as well when it comes to that. And yeah, that's really my journey for the last 1 year. What I want to really to say to everyone out there, to any woman that going through something similar, or it's actually going to have certain similar, it's going to have a hysterectomy or some kind of operation that can affect her hormone levels. So work with your consultants, what you work with your GP, and please make sure that listen to them. If you're not happy and your symptoms don't get better over time, move on to a different doctor. Unfortunately, everyone is different, and everyone have different experience as well when it comes to obviously hormones usage. So you have to know what's your best for you. And don't be afraid to try different things, but you have to find your own solution. You have to find your own dosage, and that will change over time as well. And unfortunately, like everything in life, nothing is easy, especially that. And what it strikes me really that it's no one ever explained to me um, that kind of stuff, what could happen really, and what are the possibility, because we all know this same uh, actually we all know the same symptoms like hot flashes, night sweat, cold sweats, whatever, but no one gives you another perspective view, because this is not really only symptoms that happens to women. For example, I had frozen shoulders for over 4 or 5 months after the operation, on and off, and I've been to so many specialists, and it just didn't get better. I know it could come back at any time, and I know that could be for life. But knowing that there's a solution out there that I can try to get better, it's much it's positive than just doing nothing and just deal with it, saying, oh, I'm menopausal now, postmenopausal, whatever, and I just deal with it. No, why you have to just deal with it and be like that and not having the life you want? I think you have to fight for that, and whatever works for you, could be hormones, could be just food. If you're one of the lucky ones, go for it. But whatever works for you, please, please go and advocate for yourself. And I hope you feel better and you drive as you used to be. Thank you so much for watching my video today. That was just 30 minutes, I think, around 30 minutes of catch up of what happened last 1 year with me. I wanted to do more of listing on some of the symptoms that you probably know or you don't know about post perimenopausal transition during this period. I think lots of women start having the symptoms really earlier in their late 30s, early 40s, but they just don't think these are the symptoms. And the other thing I noticed as well with some of the friends I have, so if you suffer with anxiety, with problems with your stomach or any other, I don't know, migraines and things like that during your life in general, then once you reach menopause or your transition to menopause, these symptoms will get worse. So just to let you know, and it's, you have to focus and just make sure you do your best to pass this. Thank you so much. If you like my video, please click the follow button. Check my other videos. I'm always here. DM me or send me a message below the video with any questions or any worries you may have. Not that I can give you actually a professional opinion, but I can tell you what happened to me. And if that is something that relates to you, maybe you can take what I've experienced or just another point of view. Thank you for being with me. Until next time.